This particular patient is interested in some kind of veneer for her 6 anterior teeth, and we chose COMPONEERs, or she chose them, after looking at her options. And here's the incisal view of that particular patient. And here is the Denton shade guide that we're using. The nice thing about the Denton colors is they actually fit into the enamel shade, which is this one. There are 2 enamel shades, white opalescence and universal, and there are a number, I'm going to go back here, a number of the Denton shades available. And this is an A1 shade, I believe, if I remember correctly. But that little Denton shade fits inside the enamel shade, as you can see. It telescopes right in there, and you can actually see what the color is going to look like when you blend them. I think that's beneficial. I'll go back and show you the Denton shade, the enamel shade, and there they are blended together. And that's the shade she wanted her teeth to be. Here's the sizing guide, and of course she turned out to be large, and we chose the large shade there. I mean the large size. So here we're just taking a fine diamond. Oftentimes anesthetic is not needed for the conservative preparation that is done for these. The COMPONEERs themselves are 3/10 of a millimeter in thickness, and right in the middle, and then they feather out to nothing at the margin. So you want to be sure unless you want a bolder look, a little more contour, then you can actually take about 3/10 of a millimeter off the facial and have the same facial contour. By the way, my brother just gave me a note, and the inventor of COMPONEERs is Mario Bessick. He's just a brilliant dentist in Zurich, Switzerland. All right. Anyway, so here's the preparation is about 3/10 in the middle, and then it just feathers out to the edge. So this particular patient has some class 3s and class 4 areas that needed to be filled in also, and you can see those have been prepared also. So after you prepare the teeth, then we are going to choose our size. Of course, we've already chosen the large here, and then we're going to try in the COMPONEERs. Now, they may need some shaping, and you can see we're using a Swiss Flex disc here to shape the margins, and we want to get as close to the shape of the tooth, or the size of the tooth, as we can. And you can see the incisal view here of the tri-end. These fit very well. Now, the thing about it is you really can't loop these to place with a, go back here, let me go back just a second. You can't loop these to place with a flowable composite. I had one dentist that went to my course up in Canada that came to a second course that I gave on this particular topic, and he was frustrated because he said his just weren't looking right, and then he realized he was just trying to loop these enamel facings with flowable composite. They don't fit intimately like a porcelain veneer. You have to build the intimate fit with the luting composite, which becomes a part of the restoration, and that's what we're going to see. Once you do that, they fit intimately, and here we're going to bond them directly to the tooth. But you have to use a restorative composite, specifically it's designed to use with Synergy D6 to build the internal surface so that it does fit intimately. So at this point, we're going to acid etch the tooth that we're going to place. I like to place these really one at a time. Just 10 seconds is with phosphoric etch, and you can see that it's being rinsed off, and there's that beautiful etched enamel surface that we love to see and we know is very, very bondable. Then I'm going to place a bonding agent. This is Coltene's bonding agent. One coat bond by Coltene. And we're going to massage that in for about 20 seconds and then blow it thin, getting rid of the alcohol or acetone carrier, whatever's in bonding agents, and leaving only the resin. I like to light cure it. Some people don't light cure at this point, but I like to light cure that bonding agent so that we know you've got that good bond to the natural tooth. And then I'm going to come back here, and on the internal surface of the COMPONEER, we put some bonding resin also, and it just acts as a wetting solution. rather than a wetting agent, excuse me, rather than a bonding agent. We don't cure this. We just thin it out and allow it to help the composite that we're going to place in here flow better. And this is Synergy D6 composite. And as you can see, I'm just using one of their instruments to coat the internal surface. And you want to bring it all the way to the margins, but I wanted to show you that it has a significant coverage on the internal surface of the enamel there. And by the way, these COMPONEERs are ready to bond. You don't have to sandblast them. You don't have to put any chemicals in there. You simply make sure they're clean and dry, and you place your bonding agent, then your composite. And then you also want to place some of your Synergy composite on the tooth itself, because we find out if you don't do that, it's possible that you can get some voids. So you should place a layer of your luting composite on the tooth as well as on the internal surface of the COMPONEER. And here I'm bringing the COMPONEER to place, and then you're using this instrument. It's called a placer, and it's just got a little silicone tip on it. But again, don't use this on porcelain, but you can actually press this COMPONEER to place. It'll extrude the excess material around the margins, the internal surface there. That's the Synergy D6, and then you just clean off the margins. And the nice thing about this material, by the way, this particular composite by Colting, is that it has enough what the word I'm looking for, enough rigidity that the COMPONEER will actually stay in place while you clean it up. Some of the composites, so you can use other composites inside a COMPONEER, but some of the composites are more flowable, more creamy, and it's hard to keep it in place while you're cleaning it up. So I particularly like Synergy for this also. So I clean up the excess and basically get the COMPONEER in the position that you want, and then go ahead and light cure it and just tack it in place. And then you can do some more cleanup if you like at that point. At this point, I finished the cure. So I want a good 20 seconds on the facial and lingual with a normal light curing unit, an LED, and then we're ready to finish. Now this is just like any other direct composite at this point, where if I had taken time to layer placement bonding agent, placement bonding agent, layer my dent and shade, overlay it with an enamel shade, contouring all the way, and then also even an incisal, that's what takes the time. Here, I've been able to do that in just 2 short steps. And now I'm using my carbide finishing burrs and all the other items that I use to normally contour direct composite veneers. I'm using the Swiss Flex aluminum oxide strips here on the proximals, and we just finish that in a normal way that you would any direct composite. Here I'm adding my second direct composite veneer, and that's on the central with bonding agent. Added the COMPONEER, cleaning up the body shade, light curing, the same type of finishing all the way through. And these are polishing, Alpen polishing points, and this beautiful little brush that we use to finalize it, and you get this really nice look. So 6 COMPONEERs placed on these teeth, and that's the way they were actually intended to do, to place them direct. Those are direct composite veneers, and you can see the marginal adaptation here is just excellent with these materials. You can't even feel the margins with an Explorer. You can't, if you have any voids at all, you can just fill it in with flowable composite, and you just never know. So they fit very well. It takes me about 30 minutes per tooth to place a direct COMPONEER like this.